It's time for today's Lucky Land horoscope with Victoria Cash.
Life's gotten mundane, so shake up the daily routine and be adventurous with a trip to Lucky Land. You know what they say, your chance to win starts with a spin. So go to LuckyLandSlots.com to play over 100 social casino-style games for free for your chance to redeem some serious prizes. Get lucky today at LuckyLandSlots.com.
Available to players in the U.S., excluding Washington and Michigan. No purchase necessary. VGW Group. Void where prohibited by law. 18+. Terms and conditions apply.
Ladies, we make space for you here in the Dare to Ask podcast, Season 4, Episode 10, The Talk About the Talk.
It's normal for me. It's not normal for you, and I respect that. It is a safe space, and there's nothing you're going to tell me or say that I'm going to be shocked about.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
Asking the questions like, is this something that's right for me?
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
I'm not going to scoff at anyone who says, I saw this on TikTok. Will you tell me if it's real or not? They're saying this. It's not true. And I think it is. And advocating for yourself, there's power in that.
Certified nurse midwife Tessa Hand is another one of their amazing providers. In our conversation, Tessa and I wanted to talk about young adult gynecology. How our young ladies are getting their information these days. And spoiler alert, a lot of it's coming from TikTok. We're going to navigate talking about the talk. When to talk about the talk is what age we talk about the talk. Is that important? We're also going to talk about the drip method, how it can empower your kids and also invite parents to be the safe space to ask the questions about sexuality, about body autonomy, puberty, gynecology, sex, and feelings. This is the kind of conversation that can be intimidating for most, so it's important. Let's get to it. So today you get to be on the hot seat. Young adult gynecology. We're going to talk the talk, literally. We're going to talk puberty. We're going to talk TikTok, autonomy. You game with this? Should we?
Yeah, let's do it. I love it.
Let me ask you first, are you a parent, Tessa?
I am. My kids are younger, so I have a 5-year-old. That's my daughter. And then I have 2 boys. They're 7 and 9. So we're definitely approaching the puberty years. Yes. And
when it comes to the talk, I have had it now 4 different times. It's happened at different stages and different times, and more of a drip method than one big conversation. With the kids' age ranges that you have you had some versions of the talk already?
Absolutely. I think like what you said about the drip method is spot on. Like it's not just one big talk. We're constantly giving them little pieces that empower them, but also establish us as parents as like, we're the experts. You come to us.
Yes.
And we're going to tell you the truth, and we're going to use the right terms. And then when you hear it on the playground, you're like, hey, I actually already know. I talked about that with my mom. And I know, maybe I'm not supposed to talk about that with my peers, but also like what you said isn't wrong or is wrong. Or maybe I should ask my mom more about that. And I think it just empowers them to ask the right questions, but to know who they're asking, which is the parent or an adult in their life that is appropriate. And it gives us power to just hope that we might not get it all right, but at least we're going to send them to the right person.
So right. For me and my husband has always been, we're always going to be your safe spot. So no matter
absolutely.
what the topic is it sex, is it body changing, anything, we want to be your safe space to have those questions answered. And so really it starts with anatomy. My oldest daughter, she was a very early talker, and she was just trying to identify her privates. And so she simply said, I wiped my front butt. And we realized
we got to put words to this.
But that was the intro. Here's what this is called. And then it goes from there. My 2 oldest, it felt very young when they first first started asking questions specifically about sex. It could be, I heard this, or somebody used a term, Mom, what is that? Or it could be, I'm seeing this and I'm having questions. With our two oldest, 5 and 7, I believe, I remember thinking and being terrified, this is way too young. It was because I was pregnant. But how did the baby get there, Mom? We felt like we had a really great explanation. A enters B equals C, keeping things clinical in that regard, and also using our faith as a mechanism to share. But
Absolutely.
But apparently it was not good enough because there were still some questions.
Yeah.
And so it came up again the next day. But how did the baby get there? They were looking for, but how did the baby get there?
Yes, but we want more.
But we want more.
No one asks as many questions as a midwife's kid. They have all the questions.
I'm sure. So can you give me some insight? What's it like been for you so far between the ages of 5 and 9? And what does those drip method sex talks look like?
Yeah, I think, like you said, starting with, we're giving this the right name. We're using the word vagina. We're using the word penis. We're using testicles. Like, we're using all the right words. And we know that that's empowering to kids, but it's also a safety mechanism. Keeping our young ones safe, giving them the correct anatomical terms is a piece of that. Hopefully protective in the future, and being able to know, like, okay, what are we actually talking about? Because we're not giving it a different word or a silly word. We know that when you say vagina, you know what that means.
Yep.
And I think that when they're really young, starts from a protective way. Like, okay, and when you're washing your vagina, just you're going to do it. Like, you can do it. I'm going to show you how, and then you're going to do it. And that's just for you. And those little conversations that aren't big and scary, but are like, hey, this is just for you. These are just parts that are just for you. That's why they're called privates, right? Starts in that protective. But then, as you get older and you're in that kind of 9 stage, it's like, why does this friend look different? Why does that friend look different? And it can be hard to know exactly. And I really lean on just like saying the truth, saying it in the simplest terms, really sticking to the medical or very straightforward version of it. Like you said, A plus B equals C. Is usually enough. And then when they have more questions, you answer them. But sometimes I feel like we feel called to like answer this wonderful moment with our children. And really it can just be like, yep, well, that's what this is. And then we're still making supper and we're continuing on, because it can be just so normal and doesn't have to feel like such a big question for them. And I don't think it feels like that to them. It just feels like that to us. We're for sure way more nervous than they are.
Always, right. That's the last thing we want to do, is pass on our own insecurities, our intimidation, because we want to normalize it as much as possible. I'm so glad that you brought up safety. We weren't going to turn anatomy parts into 1 and then consent into 2. It was going to be anatomy is 1 and consent is like 1A.
Yes.
It's just right there, literally part of the sentence. This is why it's called a private part. This is why it's yours. I love that you brought that up. I don't think that there is an age limit to having any kind of consent talk, much like your body and puberty talk.
When you introduce it early too, like, it's so normal. I feel like especially consent for us was more abstract. How do you do that like naturally in the moment? How does that just become part of it? And then as a parent, you're like, oh, this is really easy. Consent looks like lots of different things, but it is ingrained and it's a clear boundary. And teaching our kids to respect consent. I'm respecting you when I'm asking for consent and you're saying no, but also vice versa. And this doesn't mean we're asking them to not ask for help. It just means that we're helping show them what boundaries are. We're modeling them for them.
Yeah. Even the difference in a singular generation, young adult novels that I was reading and things that you were watching as a kid, consent looked very different.
For sure.
I think what we've even done with consent in the last decade is incredible. Me Too culture, there are changes that have made, and raising kids through this, it actually was alleviating to me that it was so easy to talk about now, because I think back to how my parents, we didn't talk about it.
Yeah, I don't think it was ever
being respectful.
Yes.
But there are so many other paragraphs that need to be said in there than just simply like be respectful to your partner.
Yes, I agree.
It's just a little bit more normal everyday conversations as opposed to really one really big one. Here's something else I wanted to talk about outside of age and when to talk about it. There's the talk. Now let's get into puberty and sexuality, because there is a big change. You can be talking about this, Mom, put A and B and equals C, but I have no idea what hormones and feelings are going to add to all of that mix. Where we're at between 12 and 14 is your typical puberty age. How do we broach sexuality conversations?
Much more complex.
Maybe even a little intimidating to you right now, since you're basically on the cusp of that.
You know, one thing that's hard is, like, as a practitioner, I can have conversations that are so frank and so easy with patients and peers. And then when you're talking about your children, it adds like this layer of, you get this layer of doubt. Okay, then maybe this is more complex, or you just, you get that self-doubt. Sexuality in itself is complex, and discussing that is so one-on-one and individual with kids. You do all that dripping so that when they have those big questions, you're that safe space to go to, because the messages are going to be mixed, and they're going to see messages on one side that say one thing and one side that say another thing. And in the end, you can help guide them through those. Or maybe they're just really complex feelings. I'm probably not going to have the right answer when my kids have those questions, but I just hope that they'll feel like they can come to me, have that like grace and platform and safe space to figure it out together.
What you just said feels like the right answer to me. It won't have to be just under a title of sexuality. You'll have already had established with them, which is, I am your safe space. Come to me about your thoughts about these new feelings. I have a 19 and 17-year-old, and then I have an 8 and a 10-year-old. So I've seen it on one end, and then as parents make adjustments, we cut our teeth on you, older ones, and now, we have the younger ones. For us, feelings and emotions and mental health, learning that with our older ones of dissecting feelings more and how that's actually helped set our new platform. So I'm not as intimidated about talking about sexuality with my younger ones as I was with the older ones, because we are already talking about all the emotions you're feeling with friends and disagreements on the playground, somebody calling you a name. Let's unpack feelings. What do those look like, sound like? How do you identify them?
We like the name it to tame it. So simple, but like, let's give this feeling a name, and then let's figure out like why we have this feeling. What can we do about it? What are our strategies with this specific feeling?
I like that. I think we're in a really interesting time right now. We obviously have better science now. We have lifespans that are going so much further. We have attitudes and societal norms that say you have all the time in the world to decide on when you want to have a family. And so we're taking that. There's parts of our body, i.e. women and our fertility, that timetable has not changed. In fact, that one still has a best by date. And we have now, how do we bring this up to our daughters? I want to be able to tell you, spread your wings. You have all the time in the world to make a decision on marriage and family and what that future looks like for you, versus in too late area, or we're in a vulnerable position.
Such a hard balance to figure that out, right? And like every individual's different feelings about when they want to have a family, if they want to have kids, if they don't want to have kids, and what that looks like. Also complex. I think early 30s is a good time if you haven't had conversations about preserving fertility and you know that bearing a child is super important to you. It's good to talk to your provider. At what point should I? At least to be planning ahead. Right? That is going to be individualized too, because you're going to have weird things that impact your fertility in your 20s. You don't have to know everything that you want. You're never going to know everything you want. I don't even know what I want some days. Having an awareness of your body when things don't look or feel right or are different, and being willing to having those conversations. My periods are weird. Will this impact my fertility? Just great conversations to be really open and honest with your provider. And if you don't have a provider you feel safe having those conversations with, you got to find one where you can. If I'm looking forward and planning for the future, what do I need to do now?
If you're looking at freezing eggs, it is costly. There's some bright spots. We're seeing some health coverage evolve, even young adult gynecology. Before a person has picked out who they're going to go and see, what age? What's your recommendation?
That's a good question. I think if you have a primary care provider or a pediatrician that your daughter feels really comfortable with and has a good relationship with, and you don't have concerns, puberty went fine, your periods are okay, they're not too painful, they're regular, you get a monthly period, staying with the person that they already have established care with is super appropriate and fine. Pap smears now are recommended at 21, so you don't need one until you're 21, but you can see a gynecologist way before that. You can see a midwife way before that. Thinking of those things, what am I concerned about? What questions do I have? Are her periods okay? Is she missing school because of her periods? Those are all great questions to address. Did she get a period too early? All things to be asking and thinking about. I think the biggest reassurance I would give daughters is, because you see a gynecologist gynecologist does not mean you have to have a pelvic exam. The vast majority we're not doing a pelvic exam on these young gals. We're talking about symptoms. We're talking about things they notice in their body, and that can give us all the information that we need to make a plan and move forward.
Yeah. Set up an appointment and have a conversation with a provider to not feel like you're totally on your own. You don't have to be on an island of isolation.
Yes, I think it takes a lot of bravery for women and young gals and young women to take some ownership over their health and their bodies. And those are complex because frequently our parents are trying to do the best and maybe just are falling short on answering the questions to the level they need to be answered. It's definitely a place where we partner frequently. That's another spot of balancing, right?
Yeah.
Trying to be very respectful, also very scientific of, okay, well, if you are having sex, here are the things that we are worried about.
Yeah.
And that's a balance as a provider. Frequently, it's parents still care. It's not a lack of caring. But then also there are the scenarios where you just don't have that good supportive infrastructure and you need somebody to talk to you like it's real, or you're just going to keep making choices that maybe aren't the best for you. And I do frequently have those kind of frank conversations of like, okay, well, this is what this road will lead you to. And let's have a little come together moment here and figure out a better plan because you can't keep going at this pace, girl.
Right. I'm so glad you're in this field with the level head that you have and knowing that we have young women to rely on you for that, Tessa. My mom heart is very happy to hear these things. For whatever reason, you're turning to TikTok, getting all of my information about body, about sex, about menstruation and fertility and STDs. And let's talk about teens seeking care on social media platforms.
Yeah, social media is not all good, but it's not all bad either. It definitely gets a bad rap. It definitely can be frustrating, misleading, misguiding. But one of the really cool things about it is people are able to look for answers to questions they aren't comfortable asking other people. And frequently they are questions maybe they're embarrassed about. Maybe they feel like they're alone, like they're the only person who has that question or has felt that. And it can be really empowering to know, hey, this is on TikTok. Other girls are asking these same questions. Other people are wondering these same things. But the caveat is you have to take that information and understand that it is not all real. For developing minds, that can be really difficult. Just because this is an expert, in quotes, on the internet does not mean that what they're saying is actually true or based in any medical knowledge or is the right medical information for you. I think TikTok as a start, hey, look on there, gather some questions, look at what you see, take those questions then to your provider. And I'm not going to scoff at anyone who says, I saw this on TikTok. Will you tell me if it's real or not? They're saying this, it's not true. And I think it is. And advocating for yourself, there's power in that. It's just navigating it all is very difficult.
Oh, we put so much pressure on ourselves. And then our young people, if there's so much added pressure, daughter who is now college age, the difference between being a senior in high school and living at home with mom and dad, being her safe space, me specifically as her mom when it comes to her body, her sexuality, all of those things. But there were still things to learn, right? There always are. Now in college, she'll bring up a TikTok. She'll forward a TikTok to me. It's her empowerment of I am learning more. And if this doesn't look right, I'm asking you.
Yes.
And this, you are still my safe space, or having somebody in your life that is. So bravo to them.
Yes. I think of that frequently. We think it's hard for us. I got a pap at 18. You got one every single year. I don't even know that I knew what a pap smear was. If someone had said, we're screening for cancer, I would have been like, what?
Yeah.
Just was like, that's what you did.
It's something called a pap smear. No idea what that is. What's HPV? Why is some scraping thing happening?
Right.
What is this?
Is there
tool?
a broom?
Right. I'm like, this is what you do. You're of age. You've had your menstruation. And if you're going to start having sex one day, we're left to like fill in all the blanks.
Yep. And now these young women get to come with so much knowledge. And I think that's empowering. And knowledge is such a gift, especially as women. I feel like, wow, we got to hold on to.
I agree.
You're putting this power in our hands. We're going to run with it. But I do feel for those that have to navigate all of this information that's so bombarding. And when they're feeling overwhelmed, I hope they have a provider that they cherish, that they can ask all the questions to, or a mom or a woman in their life, because it's a lot to dissect.
Yes, there was some beauty in blissful ignorance for us. Less options sometimes can be great. You know, you go go down the cereal aisle, and if there's only 4 choices, that's going to, but then you go down like present day cereal aisle and there's 1,500.
How do I ever decide?
So there is that pressure of navigating what's real, what's not, what's important to me, what do I just leave on the shelf, and what am I really looking for?
Yeah.
So there's no doubt about it. We've got pros and cons in both columns. Imparting that guidance, is there anything, Tessa, that you would like to share with us?
Find someone you feel comfortable with. Find someone you can talk to, whether that's your provider, someone trusted, up that you can ask those questions to. And there is nothing that's embarrassing. I frequently say that to my young adults. I understand that this is a really complicated, embarrassing question for you to ask, but this is also what I do, especially when it comes to like sex, STDs, pain with sex, feeling like their anatomy's not right. These are questions I answer. These are things I see all day long. And it is hard to understand that what's normal for me to talk about and see is not normal for you. And I respect that, but it is a safe space, and there's nothing you're going to tell me or say that I'm going to be shocked about.
Once again, thank you for being you. Providers like you, it's always been such a pleasure to know the welcoming team approach is health system wide. When there is a stumping question or issue that a patient might bring to you, let me find out for you.
Absolutely. It's that women supporting women, right, on every level. And we're supporting our patients by finding other women who will help us answer hard questions.
Exactly. This conversation is ongoing. This is a drip method.
A little bit every day, all the time.
Tessa Hand, she is a certified nurse midwife at Essentia Health. Thank you.
Great. Thanks, Corey.
Parts of that conversation with Tessa that I really enjoyed was the juxtaposition of generations. How much has changed? Consent, what it was like then versus now. Also the annual visits and the pap smears then versus now. It's incredible when you start to do side-by-side comparisons like that. Also really amazing that we're bringing that kind of science and updating it all for the benefit of all of us and our health. I think I might get a little teary-eyed. That is it. That was episode 10 of season 4 of the Dare to Ask podcast. We invite everyone at any time to listen to our episodes in all 4 seasons. Thanks for making space with us.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
I'm Victoria Cash. Thanks for calling the Lucky Land Hotline. If you feel like you do the same thing every day, press 1. If you're ready to have some serious fun for the chance to redeem some serious prizes, press 2. We heard you loud and clear. So go to LuckyLandSlots.com right now and play over 100 social casino-style games for free. Get lucky today at LuckyLandSlots.com.
Available to players in the U.S., excluding Washington and Michigan. No purchase necessary. VGW Group. Void where prohibited by law. 18+. Terms and conditions apply.